Red eye isn't always allergies. Sometimes it's an infection that can damage your vision, like ocular herpes or even chlamydia. In this episode, we break down the red eye symptoms you should never ignore, the biggest mistakes people make with eye drops, and when to get urgent care.
Red eyes are one of the most common reasons patients walk into an eye doctor's office. Most people think of infectious conjunctivitis, the standard pink eye. It's highly contagious, often sweeps through the schools and workplaces, and typically presents with watery discharge, redness, and discomfort. But not all red eyes are harmless. Some look deceptively similar, yet carry far more consequences. So, how do we distinguish routine viral conjunctivitis from herpetic eye disease, including herpes simplex virus, keratitis, and conjunctivitis, and herpes zoster ophthalmicus, better known as shingles, affecting the eye? When left untreated, herpetic eye infections can lead to permanent scarring, chronic inflammation, glaucoma, and even irreversible vision loss. Today's guest is here to help us separate the benign from the dangerous. Dr. Mika is an optometric physician and the Associate Dean for Admissions and Student Affairs at UC Berkeley School of Optometry, where she teaches anterior segment disease and serves as a clinical instructor. Her clinical and academic interests include anterior segment disease, pediatrics, and neurooptometry. Today, Dr. Moy will walk us through how to recognize red flags, make timely diagnosis, and manage herpetic eye disease before vision is compromised. Dr. Moy, welcome to the Open Your Eyes podcast with Dr. Kerry Gelb.
Hey, thanks so much for having me.
Dr. Moy, I'm really excited to have you. Doctors say how great of a speaker you are and how much they enjoy your lectures. So I thought I would have you on, and I really appreciate you being here. But let's start off. People get red eyes, as I said in my opening, and sometimes, most of the time, many times, it's innocuous, but sometimes it could be really serious. How do we determine whether a red eye is innocuous or it's something that could be very, very serious?
That's a great question. So I would say, when you're an eye doctor, you look for patterns, right? So is it one eye? Is it two eyes? What stuff is coming out of your eyes? Is it watery? Is it mucus? But I think one of the main symptoms that people should be aware of is pain. As soon as you have a painful red eye, that really ups the ante to this might be something that's serious. You should get looked at right away. Also, I would say if you wear a contact lens, contact lenses worn properly, very safe. Uh, there have been studies that show that 99% of people do not wear their contact lenses properly, whether that be they're not switching them out as they're supposed to, they're not cleaning them properly, they're not washing their hands and drying their hands before they handle them, whether that be they're sleeping in them, those sorts of things. So I would say pain is a big red flag. And if you wear contact lenses and you have a red eye, even if it's not painful, that would be a red flag as well.
With more screen usage and indoor time, myopia, also known as nearsightedness, is increasing and getting worse in children. Now, certified eye doctors can prescribe MiSight One Day, the first and only FDA-approved soft contact lens to slow myopia progression in age-appropriate children. Visit CooperVision.com to find a Brilliant Futures certified eye doctor near you. I want to tell you a story. I'm sure this is a pretty common story that you hear in the clinic over there at Berkeley. I had a patient, and this happens a lot, where they get a red eye, but instead of going to the optometrist or the ophthalmologist, they go to a walk-in clinic. And what will happen is they'll give them either an antibiotic, they'll give them an antibiotic with a steroid. And I've had a patient recently over the last month who was given an antibiotic steroid, and they came in with something we call a dendrite in the eye, and they had a herpetic eye infection. So tell us about, if you have a red eye, where is the best place to go? And then if you could follow up on giving somebody a steroid just because they have a red eye.
Yeah, so it's interesting in medicine, right? We have all these specialty areas, and it's interesting that which specialty areas sort of bloomed or have been historically formed. And so eye doctors, it's like, how come the eyes are so special? Why do they get a special, profession all to themselves? And it's because eyes are tricky. And in fact, I think if you asked a lot of general practitioners, they would tell you that eyes are a little mysterious to them. There's a lot of, whenever you have something that's wrong with your eye, it's actually best to go to an eye doctor. Now, I am an eye doctor. That's probably not surprising that I would say that. But when I talk to my friends who are general practitioners, they'll sort of say, "Oh, red eye, I just throw an antibiotic on it. If that doesn't work, then I'll send them to an eye doctor." The problem is that in adults, when adults have a conjunctivitis or a red eye, that's most likely viral. And often I describe it to patients, it's like getting the common cold, but instead of in your nose and throat, it's in your eye. Um, Antibiotics don't help that because they can't attack a virus. They're designed to attack bacteria. The other problem, though, is that what a steroid will do, and there are lots of people who will put antibiotic steroids on a red eye. Practitioners might do that. They're trying to make the patient feel better. What a steroid does is it decreases the immune system, right? So the red eye goes away, but that's because we have decreased the defenses of the eye. So when someone has a viral red eye, the only thing that's going to fight that off is your own immune system. There are some viruses we'll talk about later that we do have medicines for, but the common cold, we don't. We haven't figured that out yet. So if you put a steroid on a red eye, the patient feels like, oh, I'm getting better. Look, my eye is not as red. I see fine. Everything is fine. But all you've done is you've decreased that immune response. And that red eye is trying to tell you something. Something is wrong. Now, steroids, sometimes that's what we use because you can also have inflammatory red eyes, which just means your eye is acting like it has an infection when it doesn't. That's when a steroid is appropriate. But you really need to know what you're putting a steroid on. So in the example that you give, that patient had a very particular type of virus. They had a herpetic virus in their eye. You put a steroid on that, and now the virus, nothing is defending your eye against it. So the virus goes nuts. And you actually, even if the patient feels a little bit better, steroids can also make pain go down a little bit. They're actually getting much worse. And with certain types of viruses, this could go on to something that could scar and make the patient lose vision. So it's really important that for all people who are sick, that the doctor knows what they're treating and they're not just sort of shooting from the hip and trying something that might work in the short term in terms of symptoms, but actually harms the patient in the long term.
Now, if we look at different types of red eyes, allergic, bacterial, how do we distinguish between, how does an eye doctor distinguish between a bacterial, a viral, and a allergic conjunctivitis or pink eye?
Yeah, so you've described what I call the big three. So I would say a majority of patients, when they're suffering from a painless red eye, they've probably got one of those three things. So what an eye doctor looks at first are the pattern. Is it one eye or both eyes? So for example, with allergic, most of the time what you're allergic to is something in the air. You have hay fever, there's pollen, cat dander, it's something that's in the air. And so usually allergic conjunctivitis presents in both eyes at the same time. And the hallmark symptom is itch. And so if the patient comes in and they say, my eyes are red and itchy, well, that's allergic conjunctivitis until proven otherwise. And there's a lot of really good medicines, even available over the counter, that can be used to combat allergic conjunctivitis, some better than others. Eye doctors will steer you in the right direction. In terms of viral conjunctivitis is, and we're talking about the ones that are like the common cold, like adenoviral conjunctivitis. Those are very contagious. In fact, there's a couple of them we call epidemic keratoconjunctivitis because that's the one when you were in kindergarten, one kid got it, and then all of a sudden everyone's got a pink eye. Those tend to start unilaterally in one eye only, but then they quickly spread to both because it's such a contagious uh, uh, virus. Viral conjunctivitis is usually associated with a very watery eye versus bacterial conjunctivitis. Now, bacterial conjunctivitis actually is more common in children. So if you have an adult with a red eye and you think it's infectious, it's more likely to be viral. If you have a child with a red eye and you think it's infectious, it's more likely to be bacterial. Bacterial conjunctivitis can be in one eye, can be in both. They tend to stay on one side because they're not as contagious. It's harder for the patient to inoculate their other eye. And bacterial conjunctivitis is usually associated with more of a mucus discharge. Now, your eyeball is a mucus making machine. Anything that irritates your eye is going to create mucus. So it's really the quantity of mucus that's different. So in a bacterial conjunctivitis, there's more mucus discharge. So what usually happens is the patient, when you're sleeping, you're in a closed eye situation. Your eye is still making mucus, but you don't have like a blink to help drain that mucus away. So it starts to leak out amongst your closed lids, gets stuck to your lashes and dries there while you're sleeping. So now the next morning you wake up and your eye is stuck shut. And patients will often say, I had to pry my eyes open with my fingers. I couldn't open them by themselves. That's an indication the quantity of mucus is higher, and that's more likely to be a bacterial infection. But finally, what an eye doctor does is they use a biomicroscope. So we call them slit lamps because it can make a slit of light. And that's mainly what we're using it for, magnification. And we need to play with the light so that we can shoot it through certain tissues and see the structure of things that are going on. So one of the things that an eye doctor will do, if you've ever been to one, is they'll look on the inside of your lid. And what we're looking for is the immune response. So we'll see little bumps inside your lid. That's your immune system that's trying to fight off this issue. And we can tell the difference between the types of bumps, the type of immune response, and that helps us determine, is it a virus? Is it a bacteria? Um, Allergic conjunctivitis, I should just sort of finish the thought. That's also associated with the mucus discharge. It's not as much as a bacterial, and bacterial and virus shouldn't itch. So we look at all those things. We hear the history of the patient. We find out about their whole body system. What diseases, what chronic diseases do they have? Does that make it more likely for one thing or another? What medicines are they taking? Does that make it more likely for one thing or the other? Have they been sick recently? These are all things that we use to sort of put the puzzle together and then looking at the magnified view of the eyes to see if we can determine what's up. But there have been studies that show that when you look at how correct was a doctor in determining and prescribing the right medicine, and they do this by looking at charts from major medical facilities. And they discover that, unsurprisingly, when the patient presents to an eye doctor, the likelihood that they get the correct diagnosis is much higher than if they present to a general practitioner. And that makes sense. We specialize in eyes. That's what we do. And so we're a little bit better at determining what the exact cause of a red eye would be.
I have an interesting patient I want to tell you about. I see this a lot. So let's talk about toxic conjunctivitis. I have patients, they come in with a bag of drops. They've been to many doctors and their eyes are burning. They're a little bit red. And it turns out that it's usually a female, they're using wrinkle cream on their eyelids. And the wrinkle cream is going through their eyelid and is burning their eye. And so talk about toxic conjunctivitis.
So, toxic conjunctivitis is when you are exposed to a chemical in your environment, usually on a chronic basis. And this causes irritation. It can cause slight redness. It can cause tearing. It can feel like a dry eye. Sometimes people say to me, what does a dry eye feel like? Well, I know what dry feels like. And I heard someone give this explanation that I thought was great. And they said, you shouldn't notice your eyes in your head. As soon as you can tell that they're in there and they're moving around, that's not right. Your eyes should sort of just, you shouldn't be aware that they are there. And so the very starts of a dry eye could be that, like, I'm just aware of my eyes and I feel like I need to blink. But getting back to toxic conjunctivitis, there are lots of chemicals in our environment. And sometimes the hardest thing as an optometrist, it's easy for me to diagnose it. Like I look at you behind a slit lamp and I go, aha, something is irritating your eyes. It's not an infection. Something is in your environment. And then I tell the patient, listen, you're going to be the one who's going to figure out what this is. But let me give you some hints. It could be something in the air. It could be something. I'm old enough that I practiced back when you could still smoke in bars. And I remember we used to call this thing bartender's cornea because the bartender would be in a smoke-filled environment. I'm sure in Vegas they would call it dealer's cornea. Like if you're just in a smoky environment for so long, we see this chronic irritation on the eyes. And actually, a few years ago, we were having wildfire problems here in California. So there was lots of smoke all the time. And people would come into the clinic and they'd say, I don't know what's wrong with me. All of a sudden, my eyes are bugging me all the time. Well, look outside. See all the smoke? That's what's doing it. The trickiest one I had, we finally figured out that this patient had just installed new carpet in her house and it was still off-gassing. And that was what was doing it. Like, that's probably the trickiest one. But the most common culprits are, like you say, lotions and potions people use around their eyes. Sometimes people can be sensitive to makeup, certain types ingredients in makeup. Sometimes patients are using those lash serums to make their lashes grow longer and thicker and more beautiful, and they don't realize that's also causing their eyes to be sort of red and irritated. Um, Glitter eyeshadow is all the rage right now, and you probably see this too behind the salon. I'm like, oh, look, the tears are very sparkly today. That's all the glitter that's just falling in there. So, and then probably the other thing is sometimes people are trying to help themselves. So they go down that eye care aisle at the drugstore and they just start trying everything. Like this one says it's going to help with my computer fatigue, and this one says it's going to make my eyes sparkle and be less red. And all those bottles have preservatives in them. And those preservatives, if you're using them too much, can also create the problem or make the problem worse that you're trying to fix. So that's why, when I see patients in my practice, we are, I want to know everything that goes in your eye, even if it's over the counter and you think it doesn't count. Same thing with every supplement you're taking or medicine. I want to know all of them, even, because you didn't need a prescription to get it, it still counts. And sometimes it's helpful and really important, and I need to know what that is.
How about Visine eyes? People have been on vasoconstrictors for a couple months, and now their eyes are red. Why is that happening?
So, Visine, clear eyes, the things that have vasoconstrictors in them. The problem is your eye gets, we're going to use the word addicted. And what I mean by that is when you start, hey, that works well. Look how pretty I am. My eyes are so white. And then the next day, you need 2 drops instead of 1 drop. And then a week goes by, and now you need 3 drops to get the same effect. And that's because your body, your eyes are used to that chemical, that drug being there, and it's taking more and more and more to get the same effect. So then patients are like, if they figure it out, they'll say, well, I'll stop using this. Well, then there's a rebound effect. So now you look really red for a little while. Sorry, friend, you got to go through that to get you back to sort of a baseline. But it's interesting to me, whoever markets those products, they're really good because oftentimes I have patients come in who have problems. They've tried to fix it themselves and they name Visine. They say, I tried Visine and it didn't work. Like Visine is a cure-all to everything. And honestly, if you have a red eye for a good reason, let's say you have an infection, those blood vessels get dilated and your eyes look red because your body is trying to fight off that infection. You put Visine in there, you've actually disarmed yourself because now the blood vessels constrict. We can't get those white blood cells to where they need to be to help you out. And so you've actually oftentimes made your problem worse as you're trying to make yourself cosmetically better. You're just sort of hiding the problem, covering it up. It's better just to figure out what's going wrong and get the proper treatment.
How about chronic conjunctivitis, the 37-year-old male or female that comes in and they have a chronic red eye in one eye? They've tried a bunch of stuff and now they might need a culture. What about them?
So now we get into one of my happy topics that I'm known for speaking about. So I work on a college campus, and for those of you who went to college, you might know college is a time to discover yourself. It's a time to meet a lot of new people. It's a time to, find love, break up, find new love, all that kind of stuff. So sexually transmitted infections are more prevalent on a college campus. And when you look at statistics kept by the CDC nationally, you'll see that for all the major sexually transmitted diseases, the key demographic is sort of late teens, early 20s, up to early 30s, usually. That doesn't mean those are the only people who get it. That means more of those people get it than average. So because I work on a college campus and my practice is actually in the student health services, We see this quite a lot. So a lot of times the key symptom is the patient will say, well, I had this red eye, it wouldn't go away. I tried all the over-the-counter stuff. I finally went to the doctor. They gave me an antibiotic eye drop, then it went away. But as soon as I stopped the antibiotic eye drop, here it came back again. And so I had some leftovers, so I put that back, it went away, and here it's back again. And now I'm here to talk to you because I ran out of the antibiotic eye drop. Otherwise, I would just keep using that. So that sounds like to us chlamydia. Chlamydia is its claim to fame. It's the number one sexually transmitted disease in the United States. Woohoo! The reason is because most people, something like 50% of men, 75% of women, I may have gotten that backwards, don't have any symptoms. So you don't know that you're spreading love in all the wrong ways to your sexual partners. Well, why does it affect the eye? So the sexually transmitted diseases often are sexually transmitted because you got a bunch of mucous membranes down there. And your eyeball, like I said before, is just a lovely mucous membrane. It's a mucus making machine. And so diseases that prefer those environments also like to be in your eyes. And so the reason why chlamydia will keep coming back as a red eye is because it's interesting. Chlamydia actually replicates, divides intracellularly. So most bacteria, if you remember your biology classes, right, they kind of skitter around, they divide up, but they sort of stay on the surface. Chlamydia will actually go into a cell. That's more how a virus replicates itself. And so chlamydia can kind of hide from some antibiotics. So when we figure out a patient has chlamydia, we need to treat them sort of with two punches. First punch is they need to have a topical antibiotic so we can get rid of all the ones that are finding the cells to invade and replicate. And we need to give an oral antibiotic so that the blood supply to those cells will actually deliver that antibiotic and cause that infection to go away. Otherwise, that infection just sort of lingers and lingers and lingers. And unknowingly, depending on how you're partnered up, if one of you is treated and one of you isn't, you might just be passing it back and forth and back and forth. So this is also one of the arenas where there needs to be good communication amongst however many sexual partners you've had. And by the way, most people don't know this. If you Google inform my partners anonymously or something like that, you'll find a website that you can input information like here are the phone numbers of the partners I've had in the past X where I think I may have been infected and I just want to inform all these people. And that prevents you from having to have the awkward phone call yourself. The website will take care of that for you.
So what do you think is the best treatment? Is it the powder, the azithromycin powder, or is it just as well to do the typical Z-Pack?
So, so technically, there are many antibiotics that you could use. I prefer a gram of azithromycin because then I don't have to worry about compliance. So a gram of azithromycin, it's just you take it all at once and then you're done. Versus if you give someone a more standard antibiotic, now they have to remember to take a pill probably twice a day for a week. If they miss a dose, what if they forget? What if they, you know, we've got problems. So I like azithromycin unless there's a reason that I can't give it to a patient, like they're allergic to it or something like that. And then all they have to remember is the eye drop at that point. And usually we get this cleared up pretty quick, like within a week, we're done.
And if they can't get the pack, the 1 gram azithromycin, and they took it the way they're supposed to over 5 days, will it work as good as the gram pack?
It'll still have an effect, yes. I don't know that I've seen a study that compares those two specifically, but I would guess that it would be the same.
Okay. It's an interesting dilemma because I've noticed that some people can't get the 1 gram, so we have to put them on the standard dose. And to me, I mean, a couple times I've seen it, I'm not sure it worked as well as when they took the 1 gram. Now they might have not been compliant, but obviously we try to get the 1 gram for them. But sometimes the pharmacies don't have it; they have to order it, and it's difficult. But for everybody listening out there, we're just talking. If you think you have a red eye or a problem, you have to go see your doctor. We're giving you information here. So let's turn to herpes. I'm very fascinated with the herpes infection. I've been since I did my residency at the VA at St. Albans VA hospital in Queens, and we used to see a lot of herpes infections there. We would see a couple a week. It was very, very common. In private practice, it's not nearly as common, but in the VA, we would see a lot of it. And there's, I think, over 130 different type of herpes infections, but five that could affect the eye. So herpes simplex 1, 2, which is one is supposedly above the waist, two is
Mhm.
below the waist, Epstein-Barr, we have zoster and CMV. So if you could just talk about, let's talk with herpes simplex. Tell us what that is, and let's go over the epidemiology of it.
So herpes simplex is something that only affects primates. It's a virus that's only found in primates. So us and apes. Um, Herpes simplex is ubiquitous. In fact, you'll see studies, even like cadaver studies, if a patient is over the age of 60, there's almost 100% guarantee that they've been exposed to the herpes virus. And this can manifest itself in many ways. Since we're talking about eyes, we'll just sort of talk about the face. So people who get cold sores on their lips or in their mouth, that's a herpes virus. It can also affect the eye, either on the lid, where you see these small little blisters with sort of like a red base that's painful, but probably only if you touch it. If you're unlucky and it's on your top lid, so every time you blink, skin is rubbing against skin and you're rubbing those lesions, that can, be very painful. But the herpes virus, in most people, over 90% of people is silent, and they luckily don't have any symptoms because of it. Why does everybody have herpes? Why do all human beings end up having HSV, uh, herpes simplex 1? And I think a lot of times when you say herpes to people, they automatically think of the sexually transmitted disease. So let's be clear. Most people that I'm talking about are people who have HSV1, which is the above the belt one, as you say. And that's sort of affecting more your head and eyes.
Now, let me
So
just interrupt for a second. Now,
go ahead.
when we're young and we get a cold, a 5-year-old, a 7-year-old, that could be a herpes virus, and that could live in the body, and you don't even realize because you're sick, you have a little bit of a virus, and that's a herpes virus that lives with you, that's in you, and you don't know what it is because you're not testing the type of virus. Is that correct? And if you could
That
comment.
is, yeah, that is absolutely correct. Most people, when they have their primary infection, it just looks like a bad cold. Oftentimes they'll have at least a low grade fever, but that doesn't even help you out. And if you were to present to a doctor, if your parent took you to a pediatrician at that point because you're their darling, kiddo, and they want to make sure everything's okay, that's not even worth the time to sort of like do a blood test or a culture to see, oh my gosh, is this the herpes virus? Because most people don't have any problems when they are infected with the herpes virus. How do most people get infected? Well, it turns out it's from usually sharing food. So if I take a bite on my fork and then I let you, or if I take a sip and I let you take a sip of my drink, that's the most common way. In babies, I did my residency in pediatrics, and in babies, oftentimes you would see their primary infection, it would be around their eye. And no kidding, it's from adults kissing on them, like, oh, this baby is so cute, and they kiss them all over. And even if you don't have a cold sore outbreak at that moment, you can still pass the virus on to a baby whose immune system is not as robust if they're a newborn, for example. So this is why everybody, because I'm sure everybody can think of an instance, a kiss, yes, you can get it from kissing too. But everyone can think of an instance where, yeah, I did share food with somebody, or playing a wind instrument. Like I played a trumpet and then let my friend try out my trumpet. Those are all things that can do it.
We're going to spend most of the time talking about the eye, but if you could just comment about type 2 below the waist herpes virus. Simplex.
So HSV2 is a sexually transmitted disease because that's usually what people did to get it. Herpes simplex is a disease that never leaves your body. So we have antiviral treatments. The drugs that we use, there's three of them that are available commercially. You may have heard of acyclovir, valacyclovir, trade name is Valtrex, or famciclovir, trade name is Famvir. So these are all medicines that are used during herpes outbreaks. So most people, when they have the sexually transmitted infection and genital herpes, they will develop sores on their genitals that are painful. And at that moment in time, they can take these antivirals and have those resolve faster. You can also be put on a maintenance dose. So if you get outbreaks frequently, you might be put on a low dose antiviral over a considerable amount of time, simply so that you don't transmit the disease to somebody else. When it comes to herpes simplex, it's something that we manage. It's not something that we can cure. It stays dormant uh, in a structure in the nerve that can evade our own immune system, can't find it there, and it's safe from the antivirals there as well. So it's developed this way of sort of hiding from our immune system. Now, let's say that you don't have an antiviral pill available to you for whatever reason. Your own body will get rid of that outbreak of herpes. It'll just take longer for that to happen, and you're going to suffer more because it's painful when you have these outbreaks. But in terms of sexually transmitted diseases, it's actually not one of the top three, interestingly enough. Um, so there you go. That's herpes simplex below the belt.
Do you know what the top three are?
Number one is chlamydia, and that's because most people are asymptomatic. Number two is gonorrhea. Gonorrhea is making a comeback, unfortunately. Um, and gonorrhea, interestingly, mutates really, really fast. And so when you look at the drugs that we've used for gonorrhea, either in your eye, yes, you can get that in your eye, I hate to tell you, in your eye or below the belt. Uh, when you look at how we've treated gonorrhea as the earliest antibiotics that we have, those were used and then they became ineffective, and then we invented new antibiotics and those were used and then they became ineffective. And so now we're kind of on the last antibiotic, which is cephalosporin, which is still useful. But if you look at the World Health Organization, every once in a while they'll put out a headline that's very disturbing that says, multi-drug resistant gonorrhea on the rise, or, these sorts of things. And number three,
Is
I'm
this
checking myself. I suspect it's syphilis, but syphilis, interestingly, is also on the rise again. Syphilis, unlike gonorrhea, doesn't mutate fast. So way back when, we treated syphilis with penicillin, and guess what the best drug is for syphilis now? Penicillin. So it's quite fascinating. These two different bacteria behave very differently in terms of how they mutate and stuff. Syphilis is on the rise again, mostly in populations of men who have sex with men, more so than in other populations. So it's interesting. When I became an optometrist, I did not understand. I didn't think of two things. One was how much of my day I would spend in the dark examining patients. I knew that, but I hadn't really thought about that. And then the other one was how much I was going to have to ask patients very personal questions. And that might be because of where I practice, that I practice on a university campus. And as we talked about, sexually transmitted diseases are more common on a university campus. But I've gotten really good at asking people difficult questions. And I must say, compared to when I started practicing almost 30 years ago, um, people are much more comfortable with answering those types of questions now than they were when I first started practicing.
You talked about the maintenance dose, and before we get to the eye, but for herpes simplex, for the maintenance dose for below the belt herpes simplex, how well does maintenance dose work. So for the eye, it's what about, it works about almost 50% to keep the, about 45% to keep the somebody from getting reinfected. How about with below the belt? Is it about the same? Is it better, worse? Is that
You
something you
know,
didn't know about?
yeah, I don't have that statistic at the t tips of my fingers, but I would guess it's probably about the same. I know, as probably you do too, when patients come in and they report their medicines to us, we can look and see and tell, okay, this is an antiviral and this is a maintenance dose. And so I, you know, I would guess it's about the same.
That's a wrap on part one with Dr. Mika Moy. In part two, Dr. Moy reveals current treatment for herpes simplex. With more screen usage and indoor time, myopia, also known as nearsightedness, is increasing and getting worse in children. Now, certified eye doctors can prescribe MiSight One Day, the first and only FDA-approved soft contact lens to slow myopia progression in age-appropriate children. Visit CooperVision.com to find a Brilliant Futures certified eye doctor near you.